Let's begin with the second section of the lecture, Snoring and Sleep Apnea. And in this section, we will talk about the symptomatology and management of snoring. Also, we will discuss about the different sites of snoring at the points where the obstruction can occur or some anatomical changes occur that can lead to the snoring. And also the symptoms associated with snoring, and then the treatment of the snoring. Sites of snoring which are present, we have the soft palate. Soft palate is the top portion of the oral cavity. If you touch the tongue on the roof of the oral cavity, the front is the hard palate, that's hard, and the back is the soft palate, little softer area. So that's the soft palate. Tonsillar pillars is another site of snoring. We mentioned in the etiology of the snoring that hypertrophy of the tonsils, adenoids, all those can cause snoring. So here, tonsillar pillars is another site of snoring. Hypopharynx. Pharynx is the throat, and pharynx is divided into three parts. We have nasopharynx behind the nose, and then the oropharynx. And below the oropharynx, the third part is the hypopharynx, and that hypopharynx is also the site of snoring. So, soft palate, tonsillar pillars, and hypopharynx. Vary and multiple even in same patient. So same patient, there are variable sites of snoring, and there may be multiple. Maybe the tonsillar pillar is the site, and also the hypopharynx is the site, and it's in the same patient or same person. So the sites of the snoring may vary, and they may be multiple in the same person. Symptoms associated with the snoring. We have the symptoms which patient tells the doctor that I have these problems, and there are symptoms because the snoring usually occurs during the sleep at home, or so the usually people are not the observers of the process of snoring. So the person who snore can tell what are the different symptoms which are associated with the snoring. So symptoms include, we have snorting, spouse syndrome. So if one person is have a habit of snoring, what happens, the spouse usually automatically starts snoring also. So that's the snorting spouse syndrome. Excessive daytime sleepiness. The person who snores can tell the physician that they are tired all day long and they feel very sleepy during the day. The reason is because they snore at night, so they don't have a very restful sleep at night. That causes restlessness and sleepiness during the day. Morning headaches are present. General fatigue is also present. That's also because of the sleepless nights and the less rest during the night. The person is fatigued and tired. Memory loss, irritability, and depression. Decreased libido and increased risks of roadside accident because of increased daytime sleepiness. All these are the symptoms very common associated with the person who snore. They have sleepiness during the day, fatigue, tired, morning headaches, irritability, they are depressed, there is decreased libido, and because they are tired and they are sleepy, more roadside accidents occur because there is possibility that person might have a sleep spell while driving. Next, Epworth sleepiness scale. In this, you ask the person if they never dozing off, slight dozing off, moderate chance of dozing, and high chance of dozing. And the score is from 0 to 3. Different situations, make sure you ask the person if they ever doze in these situations. If they say sitting and reading, usually during the reading, if they said no, never dozing off, 0, slight is 1, and then we have moderate 2 and high 3. Watching TV again, 0 to 3. Sitting inactive in a public place, again up to 3. As a passenger in a car for 1 hour without break, yes, 0 to 3. Usually the chance of when the person is not performing any activity that is making him physically and mentally alert, there are more chances that they fall, they have a high chance of dozing out. So lying down to rest in afternoon when circumstances permit. Sitting and talking to someone, usually talking makes you alert and you don't doze off in that position. Sitting quietly after lunch, most likely time when the person can doze off. Sitting quietly after lunch. So all these questions you should ask the person what's their level of dozing, and then you score it accordingly to find out the level, how bad the sleepiness is affected by the snoring. Treatment is avoidance of alcohol, sedatives, and hypnotics. That's one cause that can cause snoring, so we can avoid that. It's easily preventable. Then reduction of weight. Obese people, overweight people, they snore. So if there is a reduction of the weight, we should that helps in the treatment. Overweight people, they snore more as compared to thin people. Sleeping on side is another helpful method. So usually people who sleep straight, they are more snoring than the sleeping on the side. Removal of obstructing lesion if present, that should be removed. Any enlarged tonsils, any enlarged adenoids, any macroglossia, all that can be treated to reduce the incidence of snoring. Radio frequency for volumetric reduction of tissues of turbinate, soft palate, and base of the tongue. So all these can cause snoring. So if they are treated and the obstruction is removed, this can improve the condition. Uvulopalatoplasty. Uvula is the hanging structure in the back of the oral cavity. If that is enlarged and cause obstruction, and if the palate is elongated, that can also cause obstruction. So in that case, uvulopalatoplasty is helpful in relieving the obstruction and treating the snoring problem. So all these are different treatment options that can be tried. The main purpose of all these treatment is remove the causative factor or the factor that causing the snoring. So all that complications that can occur, symptoms that can occur as a result of snoring, that can be avoided. Uvulopalatoplasty, in which you can see the diagram, the difference. One, elongated uvula is a reduction in the size is done, and that can help in the relieving the obstruction. So that's one procedure, uvulopalatoplasty. Plasty is repair. So that was all about section 2. Thank you for watching sqadia.com.